Hi, I'm Dr. Pham from Miracle Dental. I have a lot of questions regarding root canal treatment. So today I will answer those common questions about this topic so you can all understand what the root canal treatment is all about and not having too much worry when you were told that you need one, okay? So what is a root canal treatment? Root canal treatment is when the dentist go in to save your teeth when they have infection, crack, trauma, repeated dental work, a large filling. The root canal was meant to save your tooth as opposed to if you lived 50 years ago when the root canal wasn't available, then you will have to lose a tooth. So you will see grandma, grandpa, George Washington, those people, they kept losing their teeth because root canal wasn't available. So during the root canal treatment, the dentist will go in, retrieve, take out all the cavity, all the affected part. We will clean the canals. We will fill it in and seal it really well. And as the end result, you should be able to have your natural teeth in place instead of having it removed. You should be able to chew it comfortably, and it can preserve the space as opposed to when you lose these teeth, you will have a missing tooth and have a space there. What are the signs that indicate that I need a root canal? First and foremost, pain. The pain can come as mild sensitivity on hot, cold, or it can go up to escalate to the level of severe excruciating pain that wake you up in the middle of the night, or well, definitely swelling, abscess. So those are symptoms. The textbook symptom that I told my patients are usually spontaneous pain aggravated by cold. And when you drink cold food, eat cold food or drink cold drink, the pain started pretty intense and it lingers for a few minutes. Sometimes it could be for hours. And if the pain wakes you up in the middle of the night, for sure, that's a very, very good indicator that the root canal might be needed. Can a cracked tooth be saved by a root canal? In some cases, a cracked tooth can be saved by a root canal if the crack only extends to the pulp chamber, to the nerve part of the tooth. Then as the dentist removes the pulp, the infected part, for sure the dentist can save your teeth. But if the crack extended further down into your root, sometimes your tooth or your teeth may not be saved. So with the x-rays, with technology, with the dentist expertise, we will be able to help you determine. So make sure you come in for the exam and get treated early, just so it can rather be safe than when it's too late, it might have to be pulled. How does the procedure of the root canal goes? What happened during the root canal? So the first thing is the dentist will numb you. With anesthesia, you will feel very comfortable, or we will make sure that you will feel comfortable during the procedures. Then the dentist will go in with some instruments to remove the nerve, and we will continue with filling the tooth back up, seal the tooth really well, seal the canals really well. Then we usually will fill the upper part of the tooth with the material called buildup. I have the example right here. So this is the tooth that's being infected by cavity bacteria. The bacteria goes in, swimming inside the canal system, causing infection, abscess at the bottom. So the dentist will go in, we remove all the infected nerve, so the canal become hollow. Then we will put the filling material into the canals, and at the end, the canals will be sealed. After that, you will need the build-up material to fill the top part of the tooth so it's not as hollow as before. Then after that, you will need a crown. Okay, so during the procedure, you will be comfortably numbed. So before the root canal started, the dentist will explain, or I myself usually explain to my patients very well the reason why they need it and what would happen during the root canal. So my patient is covered before. During the procedures, the anesthesia will help us getting you comfortable. After the procedure, we will give you some medication to take as you leave the office, and also with the instruction with some pain medication prescribed that will help you cover with the aftermath. So in short, you cover before, during, and after. That's why root canals nowadays become very routine. Patients shouldn't be concerned about the pain at any rate. So feel very, very, very confident coming in for a root canal, especially in our office. We do a lot of root canals for our patients. So we have a lot of experience, a lot of way to make you feel at ease. And we even offer sedation in case you are having an overly anxious mentality coming in, and you heard horror stories about root canal. In our office, we do root canals days in and days out without any problem, and our patients are very comfortable walking out of the office. Will I need a crown after the root canal? It's strongly recommended almost 99% of the time. The reason is before you would need a root canal, most likely, especially in the molar, most likely the teeth have a lot of large filling, crack. So the dentist will have to remove a lot of them out. So as the end result, the remaining tooth is very weak. Then after we remove all the pulp tissues with the nerves and blood vessels, the teeth are also getting very weak. They are dried up, so they're not able to withstand all your chewing force really well. So for sure, we recommend a crown, which is designed to protect the tooth, restore it to the original shape, so you should be able to chew comfortably. So for sure, make sure you plan to have the crown done. I have a lot of patients only stop at the root canal because the pain goes away, so patients are happy thinking that they are done with the work. But please don't be mistaken. It's only half of the road. In case you don't come back for the crown, the tooth will crack, and that will be a waste of your time, effort, and the money that you have invested into saving the tooth. How should you prepare for a root canal? So when you come in for a root canal, most likely the dentist already explained to you the reason why you need it in the first place. So hopefully you have some research, have some understanding about the root canal, so you come in with all the questions already answered, so you can feel at ease. Then during the root canal, we will take good care of you, that you don't have to worry about it. Make sure you tell the dentist if you're allergic to any medication, you're on any medical treatment, you're taking any medication, just so the dentist can be aware and feel comfortable. You're in good hands if you come to our office, especially I myself do a lot of root canals. There's nothing for you to worry about. How long does it take for me to recover from a root canal? Very good question. The first day or two, you will feel quite some discomfort. Some mild pain is expected because we're dealing with the nerves here. Nerves is the sensory tissue that signal the pain. So as soon as any dentist or anyone touch the nerve, for sure there's some discomfort involved. However, you will be given some antibiotics, and sometimes some antibiotics, but not all the time. But for sure, some pain medication usually will give you anti-inflammatory pain medication to help, and sometimes we can give you steroid to help prevent swelling as well. So make sure you follow the instruction. Also, don't eat, don't chew, don't use the side that you have the root canal on for somewhere in a week kind of period, just to give it a little break to recover. But after that, you should be comfortable using it as instructed. What's the difference between a root canal and a dental implant? The root canal is used when your tooth cannot be saved, whereas the dental implant was meant to restore the missing tooth when your tooth is already lost, whether it's about to be extracted or it's already lost. There's a missing space there, so the implant was meant to put a replacement tooth into the space that you have or you already had. The root canal can be done instantly. It take a dentist in between 1 to a couple hours, and after that you need a crown, whereas the implant will take months to be replaced. The pros and cons: Preferably, if your tooth can be saved, you should save it. Preserve natural tooth is always the way to go. And another philosophy is that if you do a root canal, later something happened, you can always reverse it into having the tooth extracted. But if you start out with pulling your tooth and don't think about saving it, you can never go back to have your tooth again. So make sure you're informed, you think about it very carefully before you decide to have your tooth extracted. Why are dental crowns recommended after a root canal? To the point that you need a root canal, most likely the tooth has a very severe extended cavity. The decay was going all the way into the nerve chamber. So there's a lot of tooth structures already missing at that point. So after the root canal, the tooth becomes very hollow, very weak, and there's no more nerve and blood vessels to feed the tooth alive. So if you don't do a crown, the tooth is very prone to cracking, fracturing, and it's very difficult for you to chew comfortably. Therefore, after the root canal, the dentist always recommend you to have a crown for protection. Again, keep in mind, if the root canal come with a crown, so only think about being able to complete the whole package before you decide to go in to do the root canal. By any reason, if you don't want to, you don't think that you want a crown, or you cannot afford the crown, don't start with the root canal. You cannot do it halfway. From my experience, lots of my patients that do just the root canal and stop there and didn't want to proceed or forgot about doing the crown, the tooth will crack usually by the time they think about coming back to see the dentist. So keep that in mind. How much does the the root canal treatment cost? The cost, as always, depend on the severity, the position of the tooth. The front teeth, the premolars, are different than the molars. To finish a root canal in the molars is very difficult, require dentists with a lot of time, effort, and a lot of skill. So the fee for the molars are higher than those for the premolars and the front teeth. And also there's a lot of complication involved, such as the root is curved, the canal is split. So lots of time the dentist might have to refer you to a specialist. So the cost definitely will be higher if you have to see a specialist. The good news is most of the insurances are willing to cover the root canal, and depending on your plan, they will cover the partial cost of it. Usually they cover a percentage of it. So if you were to come to our office, I myself am able to do a lot of the root canals in-house. So I love root canal. It's one of the procedures that I'm very proud that I can help my patients a lot of time. And before we start, we usually check out the insurance and inform you the coverage, the fee very clearly. So hope that answered your questions. So there were a lot of good questions, and I hope I covered them all for you. But in case you have any further concerns or more questions, feel free to give us a call. I would be more than happy to help you answer and hopefully take away all the anxiety that you have involving the root canal. Our phone number is 702-456-0056. Thank you.